Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with bilateral fully occluding wax plugs, and I'm going to commence with this there right ear first. Initially, I decided to use an ear hook to see if I could hook and extract this wax plug out in one singular piece. But as you can see, the wax is a lot softer than I initially anticipated, and therefore the hook just dissected right through the core of the wax plug. Subsequently, I decided to instill some olive oil earwax spray, and what this olive oil earwax spray does, well, it does several things really. It helps to bind the wax together to make it a bit firmer. In addition, it helps to lubricate the inside of the suction probe, and that prevents blockages from occurring. So when you're suctioning really soft glutinous wax and skin like this, as it's travelling up the suction probe, there is a tendency of the wax plug blocking the inside of the suction probe, which means I then have to extract it from the ear and use a cleaning rod to push through the suction probe to push through and clear any blockages. And in addition, the olive oil helps to lubricate the ear canal wall, so it provides some lubrication, which then facilitates the removal of the wax. And what I'm doing here, I'm just going around the perimeter of the wax plug, trying to just elevate it, detach it from the canal walls. I am in a moment, I think, going to just put another dose of olive oil spray just to further bind this wax together, because it's just finding it a bit too soft and mushy. And I've just gone back here, and I'm going to just search for a good adequate suction grip before I attempt to remove the wax plug. If we come away with the sucker too quickly without an adequate suction grip, the wax plug's just going to remain in the ear. So we just have to feel, so it's all kinesthetic feel really, as to when there's enough suction grip in order for us to come away. And I think I've just got it there. I just felt that I've got a really good suction grip, and I then decided to just wriggle the suction probe out of the ear, and out with it came the wax plug. So I'm just going to re-enter the ear. That's the patient's eardrum, nice and healthy. There's just a bit of soft wax at the base of the ear canal near the eardrum. So this patient's ear canal anatomy is slightly different to the norm. All of our ear, well, the majority of our ears are oval in shape. And when I say oval in shape, so it looks like an American football, or if you're in the UK, a rugby ball. And that's achieved by the height of the ear canal being greater than the width. However, in this patient, the ear canal is more round in shape, so it's more circular, like a soccer ball or football. I don't think that necessarily has an impact in terms of wax production or impaction, but the norm is our ears to be more oval in shape. So you may have seen when I removed that wax plug, it's very circular, spherical. So we just proceeded to the left ear. Ironically, this ear probably was a bit more difficult to remove, but they were more symptomatic in the right ear. And that often happens. Quite often you see patients in clinic and they attend reporting severity of symptoms in one ear only, and it transpires that when you examine both ears, they actually have got wax in both ears, and the ear that they're not experiencing any symptoms is actually clinically, in terms of the removal of the wax, is more challenging, more difficult. You can see here there's loads of hairs as well that have matted into this wax plug, and I'm just trying to detach it from the posterior canal wall. When you've got hairs like this, it can be a bit more difficult to get a suction grip. The hairs just stop the sucker from making good contact with the surface of the wax plug. I'm just trying to bring this outwards. You can see there's quite a few hairs at the bottom of this wax plug where I am now. I think I'm going to use an ear hook in a moment to see if I can extract it by getting the ear hook in and behind the wax plug. This wax plug just felt a bit firmer in consistency compared to the right ear. So I was hoping I could just bring this forwards. So I'm managing to get some pieces out. That was a really hairy piece of wax that I removed. And I'm just going to the back of the ear canal now, just trying to maneuver that away, and then back to the roof. And when we're bringing this ear hook out, we're just going to be careful that we don't accidentally embed the hook against the canal wall, because then we'll make contact with it and abrase it and potentially cut through the skin, which is the last thing we want. I've just reverted back to the Zollner suction probe. So when we're using the Zollner suction probe to vacuum the earwax, we call that microsuction. And once more, I'm just manoeuvring this wax plug left to right as I want to detach it. I can feel that it's adhered to the more medial aspect of the ear canal wall. So you can see at the bottom there, that wax plug is attached to the canal wall. Managed to separate that, so we're just coming away. So quite a substantial piece. So that's the patient's eardrum. That looks nice and healthy. There was a bit of sticky wax just on the posterior canal wall. I'm just going to go and see if I can remove that. I'm going to hover over it. Clinically, not that significant. It's not going to improve their hearing if you do remove this, but I just thought if I can hover over it and it comes away, there's a few hairs again there, so that's making it just a bit more difficult. But it was just stuck, so we're just going to leave that. We don't want to risk cutting into the patient's ear canal wall or bruising it or causing any trauma whatsoever, which can then lead to an ear infection, because it's not going to, as I mentioned, improve their symptoms in any way. I'm just going to revert to a Jobson horn now, just to scoop away some of the sticky wax near the entrance. Because we're on the cartilaginous portion, we can apply a bit of pressure here. And you can probably see where the cartilage portion meets the bony part. So the bony part of the ear canal is the more redder complexion in the ear canal. You can see, and then the cartilage portion is more pale. So that's the cartilage portion, there's the bony part. That's the patient's eardrum. And you're just going to get a close-up of both wax plugs. So I think the one to the left was actually their second left ear, and the one to the right was the first right ear. Well, I hope you enjoyed that video, guys. Do take care, keep well, and stay tuned. I've got loads more videos to upload in due course. Thank you, bye.